If you're a dog owner, you've been there. That moment you realize something's not right and you're in for a long day. An unexpected bout of diarrhea is, well, messy, and it can be really stressful. So in this explainer, we're going to talk about what's going on with your dog, what you can do at home, and most importantly, when you need to pick up the phone and call your vet.
It really is the question every single one of us asks at some point. So let's build a clear framework to answer it. The goal here is to give you a bit more confidence and a solid plan for what to do next time this happens.
Okay, first things first, what are we even talking about? When vets say acute diarrhea, all we mean is that it came on suddenly and it's been going on for less than 2 weeks. This is by far the most common type we see. If it lasts any longer than that, we start calling it chronic, and that's a whole different ballgame.
Now, it's so important to remember this. Diarrhea isn't the actual disease, it's a symptom. It's really helpful to think of it like your dog's gut is sounding an alarm. It's a natural defense mechanism trying to flush out whatever the problem is as fast as it possibly can.
But here's the catch. While the gut is busy flushing out that problem, it's also losing a ton of water and these vital things called electrolytes. And that's why our number one concern with diarrhea is always dehydration. It can happen really fast, and it puts a huge strain on the body, especially on the kidneys.
So, what's actually triggering that alarm in the first place? Let's dive into some of the most common causes. They really range from the super simple and honestly kind of obvious to the much more serious.
In the vast majority of cases, the culprit is something they ate. We've all been there, right? The classic dietary indiscretion, which is really just a vet's polite way of saying your dog ate something disgusting out of the trash can. It could also be from switching their food too quickly, a new treat that just didn't sit right, or even just eating way too much, way too fast.
Next up, we have infectious causes, and these tend to be more serious. We're talking about things like viruses, parvovirus being a huge one, especially for puppies. Then there are bacteria, maybe from contaminated food or water, and of course, intestinal parasites like Giardia or different kinds of worms. And we can't forget about stress. It's true. Just like with people, anxiety can go straight to the gut. A trip to the kennel, a long car ride, even just the stress from a visit to a place like, well, my office, can be enough to cause a temporary upset.
Okay, so you have an idea of what might be causing it, but here's the million-dollar question. How do you know if it's actually serious? This part is all about turning you into a super observer for your pet. All right, let's get serious. This is your red flag checklist. While any diarrhea that goes on for more than 48 hours is definitely worth a call to your vet, some signs mean you call immediately. I'm talking about any blood or stool that looks black and tarry. That can mean bleeding. Call right away if your dog is also vomiting a lot, seems extremely tired or weak, won't eat anything, or shows any signs of belly pain. These are emergencies. Don't wait.
So, you've made that call. Let's pull back the curtain a little bit and walk through what you can expect when you get to the clinic. It's not as scary as it might seem.
Honestly, your vet is your partner in crime solving here. The absolute best thing you can do is come ready with as much information as possible. When did it start? What does it look like? Any new foods? Any chance they got into the trash? And yes, I know it's gross, but bringing that fresh stool sample is incredibly helpful for running tests.
Your vet is going to approach this logically, starting with a good physical exam and listening to the whole story you just bought them. That stool sample, that's usually the first thing we test, looking for common things like parasites. After that, blood work can give us a much bigger picture, checking for dehydration levels and making sure all the organs are working okay. And if we suspect something might be stuck in there, we might suggest an X-ray or an ultrasound to take a peek inside. So once we have an idea of what's going on, or even if it's just a simple, mild case, the whole focus shifts to one thing: getting your dog feeling better. So let's talk about the path to recovery.
Treatment really depends on what's causing it and how sick your dog is. For a really mild case, your vet might suggest you manage it at home. This usually means giving the gut a rest by holding off on food, but never water, for about 12 to 24 hours. Then you'd slowly bring in a bland diet, like plain boiled chicken and white rice. Now, the number one rule of home care, please never ever give human medications without your vet telling you to. For more serious cases, the treatment gets more intense. This often means IV fluids to fix dehydration, special prescription diets, and specific medications to treat whatever the root cause is.
And here it is. This is the most important message I want you to hear. For the vast majority of dogs with acute diarrhea, they get better quickly and without any major drama. The outlook is almost always excellent.
So what's the bottom line? While this is super common and usually not a huge crisis, your knowledge is your power. Understanding the difference between a simple upset stomach and a real emergency is what makes you such a great advocate for your dog's health. Which really leaves us with one last thing to think about. Beyond just reacting to problems when they pop up, how can we be proactive? What are the little things you can do every single day, managing their diet, keeping their stress low, to really support your dog's gut health and their overall well-being? Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They're your best resource for ensuring your companion lives a long, happy, and healthy life.